The coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, says President Tinubu's administration has launched an unprecedented nationwide distribution of free medicines and medical supplies to vulnerable communities. He is speaking in Abuja at the official flag-off of the nationwide distribution of medical equipment and essential drugs to states. Professor Pate said all sectorial targets that were set in 2023 are now being met according to plan, bringing quality health services closer to Nigerians, regardless of where they live or who they are. Professor Pate described the exercise as more than just an event, but a promise kept, noting that for too many primary health centers had remained under-equipped and underutilized.
2 years ago, we embarked on an ambitious effort to revitalize the primary healthcare system, setting targets, and now we are seeing that promise being kept. And I believe that with this effort, the access to quality health services will be much closer to our people, no matter where they live and no matter who they are. And the journey is not that for government alone. I call on all Nigerians to join us in protecting their primary healthcare centers and supporting the healthcare workers in the front lines. Own and treat the facilities as theirs.
We also commenced the distribution of maternal and newborn health commodities. And just a few weeks ago, we also did the same for coaching equipment, solar direct drive, Back to this equipment, Honorable Minister, we have 56 different primary healthcare relevant medical equipment here. They include heat ovens, incubators, diagnostic equipment like binocular microscopes, autoclave machines, delivery beds, portable ultrasound machines, and all.
Still talking health, the coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, says the administration of President Bola Tinubu remains fully committed to eradicating Lassa fever and other emerging infectious diseases while strengthening regional health security across West Africa. He made the remarks in Abidjan, Côte d'Ivoire, at the opening of the ECOWAS Lassa Fever International Conference 2025 with the theme Beyond Borders, strengthening regional cooperation to combat Lassa fever and emerging infectious diseases. Professor Pate emphasized that Lassa fever, first discovered in northeastern Nigeria, has continued to claim lives for decades, threatening health systems, attacking frontline workers, and undermining regional health security.
Lassa fever does not respect regional boundaries or national boundaries, and neither do other emerging infectious diseases. Our strength lies in the unity of our responses, in the willingness of our nations to work together, to share knowledge, and to coordinate resources to protect the health of our people. Across West Africa, Lassa fever continues to pose serious threats to lives, livelihoods, and health systems. Nigeria, like several of our neighbors, has borne a significant share of the burden, with outbreaks affecting multiple states each year. The human cost is considerable, and the socio-economic impact is equally profound.